Hey, and welcome to this segment of Ask a Physical Therapist. My name is Austin Kercheville with Excel Rehab and Sports, and I'll be answering the question today, is physical therapy important for a hamstring strain? I think this is a really good question because these injuries are very common. Whether you're a recreational runner, a weekend warrior, or a competitive athlete, you may have dealt with one of these and you know that they can come back easily. Did you know that at least 1/3 of hamstring injuries will recur within the first year? After your injury. So everybody kind of knows the RICE, rest, ice, compression, and elevation, and that stuff is great for the acute phase of a new hamstring injury. However, this doesn't address regaining the tissue strength and tolerance to loading that is required with a big, strong muscle like the hamstrings. So physical therapy can actually help a lot, not only in decreasing the initial pain and managing that acute phase of an injury, but also is really essential for regaining the tissue strength. So that means a PT would work with you on really specific exercises that are individualized to your needs and your stage of irritability, your stage of healing, to progress you to strengthen your hamstrings to tolerate from really slow loading with a lot of weight all the way up to the kind of quick, fast plyometric loading that's involved in things like sprinting. So long story short, physical therapy can help shorten how long you're dealing with your hamstring injury and decrease your chance of re-injury when you return to your activity.